Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
You know, we've all had them. That pounding in your head, it can be anything from just a minor nuisance to, well, a really urgent message from your nervous system. So today, we're going to decode these headaches and help you understand exactly what your body might be trying to tell you. Yeah, that familiar pressure, it can be distracting, sometimes totally debilitating, and honestly, sometimes it's genuinely scary. So the big question is, how can you tell the difference between a simple stress headache and a serious warning sign? Well, let's find out. All right, first up, let's talk about the most common culprits out there, primary headaches. Now, the key thing to get here is that with these types of headaches, the headache itself is the main problem. It's not a symptom of some other underlying disease going on. So let's start with the one pretty much everyone has experienced at some point, the tension-type headache. I mean, the name kind of gives it away, right? It's often linked to those tight muscles in your neck, your scalp, your jaw, and all that gets combined with your brain just becoming a little more sensitive to pain signals.
Okay, so how do you spot one? Well, it's usually felt on both sides of your head. It's like this constant squeezing pressure, as if a tight band is wrapped around your head. The pain is usually mild to moderate. Just think of that classic end of a long day headache after staring at a screen for hours. That is a tension headache.
Okay, now let's talk about the migraine. And I really want to be clear here. This isn't just a bad headache. No way. It's a really complex neurological event. We're talking about a wave of activity that spreads across your brain, activating major pain nerves and releasing all these inflammatory chemicals. It is a completely different beast from a tension headache.
And yeah, the experience of a migraine is totally different. The pain is usually just on one side of the head and has this signature throbbing or pulsing feeling. And it often brings along some, let's call them unwelcome guests, like nausea and this extreme sensitivity to light and sound. Some people even get what's called an aura beforehand, these weird visual disturbances like flashing lights or zigzag lines.
So let's just put these two side by side for a second to make it super clear. A tension headache, that's typically on both sides with a mild squeezing kind of pain. A migraine, usually on one side with a severe throbbing pain and often with nausea. Really understanding this difference is the first major key to knowing what you're actually dealing with. All right, our third primary headaches is something called a cluster headache. Now, this one is much rarer than the others, but it is infamous for being excruciatingly painful. We think it's linked to the hypothalamus, which you can kind of think of as your brain's internal clock. The pain, it's just excruciating. It's always one-sided, and it's centered right around the eye. And often it comes with tearing or a stuffy nose, but only on that same side. The reason it's called a cluster headache comes from its pattern. They happen in cycles, maybe at the exact same time every day for weeks, and then, poof, they can disappear for months. Okay, so far we've covered the common culprits, the primary headaches, but now we really need to shift gears, because sometimes that pain in your head isn't the main problem at all. It's a symptom, a warning sign that something else, something much more serious is going on.
And that brings us to our next category, secondary headaches. These are the headaches caused by an underlying structural problem or some other issue inside your skull. And folks, this is where listening to your body becomes absolutely 100% critical.
One of the most serious causes is what's called raised intracranial pressure, basically increased pressure inside your skull. I want you to think of your skull as a sealed box for a moment. If something inside it starts to grow, like a tumor, or if there's a buildup of fluid, the pressure has nowhere to go but up. And this pressure stretches the sensitive lining of the brain, causing a very, very distinct type of headache. Now, the warning signs for this are probably not what you'd expect. This kind of headache is often at its absolute worst first thing in the morning. It gets more intense when you do things like cough, or sneeze, or strain. It can also be associated with projectile vomiting and even swelling in the back of your eye, which is something a doctor would spot. Okay, I really need you to pay close attention to this next phrase. It's called a thunderclap headache. What does that mean? It means a headache that goes from 0 to its absolute maximum, most excruciating intensity in less than a minute. This might be the single most important headache description you can ever learn. Why? Because if you or anyone you know ever experiences this, it is an absolute medical emergency. I'm not kidding. It often signals a bleed in the brain,
something like a subarachnoid hemorrhage, where every single second is absolutely critical.
So what's happening is that blood is suddenly irritating the brain's sensitive lining. This thunderclap is almost always accompanied by a stiff neck, and it can lead to confusion or even loss of consciousness. It is, by definition, a neurological emergency.
Another really serious one is meningitis or encephalitis. This is basically an infection that causes inflammation of the brain's linings. The key combination, the thing you have to watch for here, is a headache plus a fever. If you see those two together, especially with neck stiffness or a sensitivity to light, that needs immediate medical attention. No waiting around.
Okay, I know that was a lot of pretty serious information. So you're probably wondering, how on earth do I keep track of all that? Well, fortunately, doctors use a really simple tool to remember and spot the red flags. And you can use it too. It's called Snoop.
Let's just walk through it together. S stands for systemic symptoms. Think fever or unexplained weight loss. N is for a neurological deficit. We're talking any new weakness, numbness, or changes in your vision. O is for onset. Was it sudden? Like that thunderclap we just talked about. The second O is for older age. A brand new type of headache that starts after age 50 is always something to look into. And finally, P is for pattern. Is the headache getting progressively worse over days or weeks? If you check any of these boxes, that's your sign. It's time to see a doctor.
So after all of this, what's the big takeaway? What's the one thing you really need to remember? It all comes down to empowering yourself by actually understanding what your body is trying to communicate. Look, the vast majority of headaches are totally harmless, just a part of life, but a small fraction of them are not. So the single most important takeaway here is this: learn to recognize the patterns and learn to recognize the red flags. Understand the crucial difference between a common headache and a critical warning sign.
We've basically laid out the roadmap for you here, a way to decode what your headache might mean. You now have the tools to be more aware, to be more informed. So the only real question left is, will you listen to the signals?